Hi, I'm Magyn Darmsteader. I am a PTA, pelvic health specialist, pregnancy and postpartum corrective exercise specialist, sexual wellness educator, and Pilates for pelvic floor instructor at Hope Physical Therapy and Wellness. I am incredibly passionate about pelvic health, so I wanted to quickly introduce what the pelvic floor is because most people don't actually really know. And I wanted to discuss ways in which PT can help to treat pelvic floor dysfunction. So first, let's introduce the pelvic floor. It goes so much farther than what we generally consider, which is, for most people, I think just external genitalia. 100% of humans have a pelvic floor. Man, woman, child, however you identify, it is not gender exclusive and it's not age exclusive. Everybody has one. So if we think of our body like a canister or a tin can, the pelvic floor is the bottom of that tin can. So your core, your rib cage, your back, those are the front, sides, and back. And then you have the top, right? Pelvic floor sits at the bottom. It consists of a group of muscles, tendons, ligaments, and other connective tissue, including our organs, that form a very complex, dynamic, and reactive support to our body. It has 5 major functions. One, to just provide support, right? It is the sling at the very bottom of our canister. It provides stabilization to the trunk and to the spine with dynamic movement. It controls bowel and bladder function. It regulates sexual function. And it acts as actually one of the most important pressure regulating systems in the body. It is a part of our circulatory and lymphatic system. So it acts as a sump pump. Its range of motion helps to move blood and lymph back up to the heart. I could actually go on and on about all of its functions and how it relates to every part of the body, but we actually don't have time for that. Suffice to say, it plays a huge part in everything we do, including breathing, walking, digesting, everything. And because of the pelvic floor's role in providing support and stability as a very necessary component of our core, injury to the pelvic floor can also affect other parts of the body, such as the neck, the back, the hip, even the knee, down to the foot and ankle. All parts of our body talk to one another, and no injury happens alone. So what happens then when things go wrong, or really when things just kind of forget how to coordinate? Well, we end up experiencing maybe urinary and fecal incontinence, which is what most people primarily think of when they think of pelvic floor function. But it goes so far beyond that. I also want to take a moment to say that PT is actually the gold standard of treatment for most pelvic floor disorders, which we're going to talk about in a second. It is proven to be more effective in most cases to surgery or medication. Often those just kind of serve as a band-aid or can, in some cases, further complicate what you're experiencing. Our bodies don't really like surgery. And of course, that's not to say that those things don't have a purpose and a place. They absolutely do. However, conservative treatment, conservative management is indicated to be the first thing that we should really be exploring. And so pelvic PT is exactly that. So anyway, what are some common diagnoses that we treat and that we see? As mentioned earlier, incontinence. We treat tailbone pain, overactive bladder, interstitial cystitis. It's grade A, actually, in terms of treatment for IC. Pelvic organ prolapse, infertility, pregnancy-related pain. We prepare people for labor and delivery. And then we address postpartum recovery. So the 4th trimester is very real. We treat post-surgery considerations, so C-section, hysterectomy, any type of abdominal surgery. So that includes even surgeries for hernias. We treat prostatectomies. We do pre and post-op for that. We treat constipation, IBS, any, GI disorder, pudendal neuralgia for those with compression injuries like cyclists, endometriosis, any type of pelvic pain or vulvar pain, or if you have, male genitalia, any pain associated with that, any type of sexual dysfunction, really. And that includes difficulty or inability to orgasm. We have or treat hip, groin, low back pain. All of that is connected. Your pelvic floor, at least the deep pelvic floor, are really just, low back and hip muscles. The list is very, very long, and I can't include everything in this video. But suffice to say, pelvic PT can be the important missing link in your overall health. If you're interested in learning more about this, or you have any questions, please contact us. We also have some resources on our website, and I'll be working to develop some more just basic education regarding overall pelvic floor health. So please give us a call, at least to have a conversation about whether or not pelvic PT can help you. We provide, and I'm very passionate about providing, discreet, holistic, trauma-informed care. Your safety is our biggest priority. Thank you for taking the time to listen, and we hope to see you soon.